bit, but first we want to get to some breaking news about the coronavirus vaccine. An FDA panel endorses emergency use of Pfizer's COVID-19 vaccine in a major step toward an epic vaccination campaign against this outbreak. This is big.
Yeah, a meeting just wrapped up by an advisory committee to the FDA on the Pfizer vaccine for the virus. And so how do we know it's safe since we got here so quickly? Medical reporter Liz Bonis has been following this story today. She joins us now with details. It's what everybody's been asking, Liz.
Certainly has been that. Hello to Paula. Hello to you. Hey there. We have waited for this day for a very long time. I'm so excited to have this discussion. Question, of course, many of you have asked along the way came up several times at this advisory committee meeting today. Again, they did recommend emergency use authorization of the Pfizer vaccine. But, you know, how do we know? This is what you're asking. These vaccines came so quickly when usually it takes years. How do we know they're safe and that researchers did not cut corners to get here? For the past several months, Robin Woods has been a vaccine trial participant in spite of the controversy surrounding it.
It doesn't feel good to have people say it's a waste of time, that you're going to be a guinea pig, that what are you doing? But it makes me feel good that I am contributing.
He doesn't know if he got the actual mRNA vaccine or a placebo, but says other than an achy arm, he's had no side effects. His participation, however, one way we know no corners were cut in this vaccine research. Both the Pfizer and Moderna vaccines have been tested with no severe side effects reported in a variety of people, all races, all adult age groups, and all body weights.
A vaccine is going to be for everyone, and that's what we really need to prove to make it the safe and effective vaccine we can use going forward.
The second way we know no corners were cut has to do with the volume of people tested. Dr. Greg Gottslick has been a researcher for more than 2 decades. He says most trials take more time because of recruitment delays. For the mRNA vaccine trials for coronavirus,
we're analyzing large numbers of patients, and that's why you've heard numbers like 30,000, 40,000, 60,000 patients enrolled in these trials nationally. So as a large number of patients are enrolled, we're able to see the signal if there is something we need to be wary of.
Finally, the third way we know no corners were cut in this vaccine research has to do with how these research trials were conducted. Those looking at the mRNA vaccine say to shorten the time to FDA emergency use authorization, they did not skip steps.
That's absolutely true. We are compressing steps and we are overlapping steps. And I think I've mentioned to you previously, you know, our collaborations with the FDA and other regulatory authorities, they are giving very thorough reviews, very comprehensive, very thoughtful. We've been on the phone with them at 9 o'clock in the evening. We've been on the phone with them on weekends. So they're really being Herculean in their efforts, but no shortcuts here. You know, you have to check all the boxes, as they say, and we wouldn't be doing anybody favors if we ultimately ended up with a vaccine out there that hadn't been thoroughly evaluated and know all the risk associated with it.
Boy, well said. It's been a privilege to share those researchers and the journey along the way. Now, since everything is benefit versus risk, the person who can help you balance your concerns best is your own healthcare provider. They really invite your questions. I've been talking to many of them, and they hope you will ask. Guys?
All right, Liz, great information there on the big story tonight, one that everyone is talking about. We should note here, the FDA does not have to take the recommendation of the advisory committee. However, it usually does.